Welcome to this video. It's titled Type 2 Diabetes. Part 1 of this video is insulin resistance, and if you haven't watched that video yet, please, I recommend that you watch it before you watch this one because it's gonna be the following of insulin resistance. What is type 2 diabetes? I would say that it's a disease of too much carbohydrate, and you saw in the first video, part 1 of this video, how too much carbohydrate causes insulin resistance and diabetes. Please, let's listen to these two scenarios I got in the pharmacy last week.
Hi Miss Adeline, my name is Bertha. I have been taking medications for type 2 diabetes for 7 years. I geniusly take my medications as prescribed. I started with only one drug, now I am on 3 different medications. I diligently follow all instructions my doctor gave me, yet it doesn't seem to get better. I do not understand. I am tired of medications. What do I do to get rid of diabetes, please?
Hi, I am Mr. Smith, and I was diagnosed with diabetes 18 years ago. I have been diligently followed my doctor instructions, so far still my condition does not improve. I started with only one oral pill 11 years ago, now I am on 3 different medications and a high-dose insulin. I have also gained so much weight. My doctor thinks that I am doing fine because my numbers are normal for the most part. But I am sick and tired of sticking my body 8 times a day to check blood sugar and inject insulin. How do I get rid of diabetes, please?
I am using cartoons here to represent those two people, but they are real life people just like you and I. Both were really frustrated. Can type 2 diabetes medications treat type 2 diabetes? Can type 2 diabetes be cured? Before I answer these questions, please allow me to bring up some insight of type 2 diabetes. Make sure you watch until the end. Stay tuned. Welcome to this channel. My name is Adeline. I am a doctor of pharmacy. According to CDC, Centers of Disease Control, the prevalence of diabetes in America is 11.3%, and according to statistical.com, the prevalence of diabetes worldwide is 10.5%. And we all know that these are the data from the tested people. We have so many people that did not get any test. So it's actually much more than that. What causes diabetes? Genetic is part of it. It is important for you to know your family history. Does your parent or grandparent have diabetes? But that doesn't mean that if you have it in your genes, you will necessarily develop it. The main causative factor of diabetes I am going to mention here that can be controlled is lifestyle. If you have diabetes in your family history like me, you are more prone to develop diabetes compared to somebody that doesn't have diabetes in his or her family history. And my recommendation for you would be to be on the defensive side with your lifestyle. How is type 2 diabetes diagnosed? We are not going to spend time on this. Your doctor would collect the symptoms or signs that you have and order some labs for you. Those symptoms are excess urination, excess thirst, frequent hunger, blurry vision. Frequent urination is mostly due to the excess glucose into the bloodstream because of insulin resistance. The kidney try to clean up glucose by sending glucose via the urine, and as a result, guadals also follow glucose and the body is dehydrated. When the body is dehydrated, the brain would signal you by thirst so that you can drink water and compensate the loss of water. And hunger is due to the fact that you are eating, but the cells are not getting glucose due to insulin resistance, due to the inability of the cells to uptake glucose, and as a result you feel hungry even when you are eating a lot. And lack of energy also with people with diabetes is due to the same reason. You are eating enough food, but the cells are not getting glucose to make energy, the energy that the body needs. Also, some people with diabetes in the early stage would also have blurry vision. Blurry vision is due to the glucose deposit into the capillary. The tests that your doctor would order are the A1C, which measure your average blood glucose during the past 3 months. If you take a look at the A1C chart, your A1C is less than 5.7. The second test is the fasting plasma glucose, which is usually done after 8 hours fasting, usually in the morning before breakfast. Here, your medical provider is looking at a fasting plasma glucose of less than 100 milligram per deciliter. The third one is the oral glucose tolerance test. They test your blood glucose and 2 hours after giving you a very sweet liquid. After 2 hours, your aim blood glucose should be less than 140 milligram per deciliter. Another test that your doctor or medical provider might order is the random plasma glucose. That one is done at any time of the day. And if your random plasma glucose is greater than 200 milligram per deciliter, they will diagnose you with type 2 diabetes. Other symptoms or signs of diabetes are infections. Bacteria or fungus love sugar or glucose. Because of excess glucose in the body, people with diabetes have tendency to be very infected compared to people with no diabetes, or particularly uncontrolled diabetes. Infection of the skin, vagina infection, urinary tract infection. People with type 2 diabetes are more prone to these type of infections. Slow wound healing due to impaired nerves and blood vessels. Thinking process. Excess blood sugar causes mood swing. Many people with diabetes have diabetes distress. Peripheral neuropathy. Numbness and tingling is common in people with type 2 diabetes due to nerve damages. Low libido or low sex desire and or low sex performance is common in people with type 2 diabetes, and that is due to blood vessel damages. Long-term elevated blood sugar causes damage of the capillaries that causes diabetes retinopathy or eye diabetes that causes blindness in long term. Many people with type 2 diabetes also have glaucoma and cataract. Periodontal disease, which is the infection of gums and the bones that hold the teeth in place, is common in people with type 2 diabetes. Many people with type 2 diabetes also face foot damage, which sometimes leads to amputation. Diabetes put people at very high risk of cardiovascular diseases or heart diseases, including heart attack and stroke. Diabetes is also the #1 cause of kidney diseases and kidney failure. Now that we are refreshed on what diabetes is, let's answer the questions that were asked in the beginning and get into the treatment part, which is actually the fun part. Can diabetes medications treat diabetes? Diabetes medications are very helpful in controlling diabetes symptoms. There is no doubt about that. Many of them were designed to remove glucose or sugar from the bloodstream, which is very important to control diabetes. Some have the ability to lose weight. Some of them are designed to reduce appetite and as a result to lose weight, which are all good. Let's talk about the case of Mr. Smith, for example. Diabetes medication has been controlling his diabetes symptoms very well. He says that he has some blurred vision from time to time, but overall, he's fine with his eyes. He said he sees an ophthalmologist or eye doctors frequently, and a podiatrist or foot doctor regularly as recommended by his primary care physician, and his eyes and feet are fine. He also said that the nephrologist or kidney doctor and the cardiologist or heart doctor confirmed to him that his kidneys and heart are just doing well. Mr. Smith started with only one oral medication 18 years ago, and now he's taking 3 different oral medications. He stated that he was put on a low-dose insulin 9 years after his diagnosis, and now he's on a very high-dose insulin, and he has also put on so much weight. You can tell that with time, those medications might not be able to control his blood sugar anymore, and he will start getting diabetes symptoms and complications we just talked about. What quality of life do you think Mr. Smith has? He complains about being sick and tired of sticking his finger 4 times a day to check his blood sugar and sticking his abdomen 4 times a day to inject his insulin. He complained about seeing so many doctors: eye doctor, foot doctor, kidney doctor, heart doctor, his primary care physician, and other doctors. He said it's difficult for him to keep up with all those doctors' appointments. So, the answer to the question is diabetes medications do not treat or cure diabetes. It's good at helping with controlling diabetes symptoms. The other question is, can type 2 diabetes be cured or reversed? And the answer is simple. Yes, type 2 diabetes can be reversed. Reversing type 2 diabetes is actually less complicated than you might think. It's very simple. To reverse type 2 diabetes, we only need to reverse insulin resistance, which is the root cause of type 2 diabetes, and that's it. There is no medication out there in conventional medicine that treats the root cause of diabetes, which is insulin resistance. All medications that's used in conventional medicine to treat diabetes only treat diabetes symptoms. That's why people take those medications for years and their condition doesn't go away, and their quality of life just keep going bad. The medications currently used for diabetes were not designed to treat the root cause of diabetes, which is insulin resistance. Just like Mr. Smith and Ms. Berder, since I started working as a pharmacist in 2018, I don't know how many people have come to me and told me they have been doing everything as recommended by their doctor for their diabetes, and their quality of life is just getting worse. Insulin resistance, in my opinion, is an underestimated public health issue, and I do believe that awareness needs to be raised regarding insulin resistance, particularly in conventional medicine. Here are my hints to reverse type 2 diabetes naturally. Of course, it's to reverse insulin resistance. Before I get into that, I want to bring to your attention that if you have had diabetes for years that you haven't been able to control, and that you have gotten into some long-term complication of diabetes, you might not be able to reverse those complications. The complications we talked about earlier, like blindness or cataract or glaucoma due to glucose deposit into the eyes for years, or maybe kidney failure, or maybe just kidney diseases. You might not be able to reverse those conditions, but at least reversing insulin resistance would still increase your quality of life and help you with that diabetes. Why those conditions might not be reversed, those complications of diabetes, you can actually reverse the root cause of diabetes itself and get a better quality of life. That being said, let's jump into our topic now. So my first hint is, are you on any prescription medication for type 2 diabetes? In case you are on any prescription medication for type 2 diabetes, in order for this process to work for you fluidly, you want to get your medical provider or your doctor on board, because you need them to adjust your medications as you go through the process. This is very important. You also need to make sure that your medical provider or your doctor understands the process of reversing insulin resistance naturally. Trust me, many doctors and medical providers in conventional medicine do not know this, and you cannot blame them for that, because they did not learn that in school, and they work with their employers' policies, which is based on conventional medicine. And I am going to tell you a story that is going to shock you in a moment. My second hint is diet. Diet on its own is enough to reverse type 2 diabetes. Remember in the beginning when I defined type 2 diabetes, I said that it's a disease of too much carbohydrate. And before I say anything else about diet, the very first thing to do with your diet is to cut away all processed refined food. That's where to start. Before you even reduce your carbohydrate intake, cut down all processed food. That's the first thing to do, the very first thing to do. When I asked Ms. Bernard what she eats in a day, she said her dietitian recommends she has 45 to 60 grams of carbohydrate per meal per day. She has 3 meals every day, and that she has 15 to 20 grams of carbohydrate per snack. She does have 3 snacks every day. So that means that Ms. Berda has a mean of 200 grams of carbohydrate every single day. That's too high for somebody that has a disease of too much carbohydrates. If you do have type 2 diabetes, which is the disease of too much carbohydrates, you shouldn't be getting 200 grams of carbohydrates daily. That's a lot. Cut down those carbohydrates. Cut them down considerably and replace some of those carbohydrates by some healthy fats and proteins. Oh, many people are actually afraid of fat. When many people hear fat, they are uncomfortable. But trust me, fat is not the devil here. The devil, when it comes to type 2 diabetes, the disease of too much carbohydrates, is carbohydrates. The devil here is not fat at all. Don't be afraid of fat. Cut down your carbohydrates. Replace those carbohydrates that you cut down by some healthy fat and some healthy proteins. Make sure that all your meals have enough fibers and that you are getting the daily required amount of water according to your body weight. Diet is the elephant in the room when it comes to reversing type 2 diabetes. I have seen so many people that have reversed their type 2 diabetes by diet. If you are eating 3 meals and 3 snacks with a total of 200 grams of carbohydrates every day, you are not giving your body any chance to function without the use of insulin. And burn your storage fats with counter insulin hormones. I heard somewhere people were saying that intermittent fasting is not good for people with type 2 diabetes. That type 2 diabetes individuals should not do intermittent fasting. That is not true. Many people with type 2 diabetes have already put in their mind that they should eat 6 times daily, 3 meals and 3 snacks at least. I think people with type 2 diabetes actually need to practice intermittent fasting more than anyone else. What they need to do before starting is to get their medical provider or somebody on board that will help guide them and adjust their medications down as they go through the fast. The shocking story I promised to share with you is the story of the husband of one lady that came to the pharmacy one day to pick up her husband's insulin. When I noticed that he was on a very high dose insulin, I asked her if they have tried any non-pharmacological method to treat his type 2 diabetes. The lady said that he started intermittent fasting a few weeks ago, but because his blood sugar was dropping low, his doctor asked him to stop it. I was so disappointed. What the doctor needed to do was to tape his insulin down and let him continue the fast and keep taping his medications, his diabetes medications and insulin down as his blood glucose keep dropping down as he progressed through intermittent fasting over time. That is how people get out of medications. Unfortunately for that man, his doctor didn't get it. Unfortunately, as I said earlier, many medical providers in conventional medicine are not aware of this. I will be bringing more videos on how intermittent fasting is properly done. Another hint I do have is physical activities. My 4 hints are proper stress management and quality sleep every day. Those have a good impact on reversing insulin resistance and on overall health. Are you a smoker or do you drink alcohol? Those are also very important to manage if you want to reverse insulin resistance and also reverse type 2 diabetes. If you do want to learn more about insulin resistance, please watch these 2 videos on metabolic syndrome and central obesity. I have seen so many people that reverse their type 2 diabetes. Don't let anybody tell you that you cannot reverse type 2 diabetes, that type 2 diabetes cannot be cured, and that you will be taking a lot of medications of type 2 diabetes all your life. No, don't let anybody deceive you. You can do something about it. It's not easy at all, but it's doable. Some other people have done it. That means that it's possible. Do your own research. If you diligently follow these steps, these hints I just share here with you, I am sure that you'll be likely to either totally reverse your condition and get rid of all your type 2 diabetes medications, or you reverse it partially and get rid of the majority of the medications and stay only with only 1 or maybe 2 medications. What you really need is somebody to support you during the process. If you do have type 2 diabetes, or someone in your family has type 2 diabetes, some of your loved one, and you have been battling with it, please drop a comment below to let us know, to share your experience with us and let us know how you are doing with that. If you have gained some value from this video, please like and share. That goes a long way. If you would like to be notified the next time I post a new video, please subscribe. Hit the subscribe button. If you have watched some of my videos before, you know that I always ask people to share love around them. Please do me a favor. Spread love around you. Thank you so much for watching. See you next time.